It's not what you look at, it's what you see.
Look for the silver lining whenever a cloud appears in the blue.
Hello and welcome to another episode of Between Us, Make Every Conversation Count. Today we're going to talk about something very important, a conversation which is happening around us. This is the year 2023 and we are still struggling with mental health awareness, emotional well-being. In our episode today, we have with us Dr. Rupa Rao-Nayak, who's a practicing homeopath and a counselor and therapist. Rupa, welcome to the show.
Good morning, Santosh. Thank you so much for having me here today. It's an absolute pleasure.
Pleasure is all mine because I think we're going to talk about something really, really interesting, something which matters.
Yes, mental health. Everyone talks about it, but no one talks about it.
What is mental health?
So, by definition, mental health is a state of emotional, psychological, and social well-being.
Mhm.
It affects how we think, act, and feel, and also our ability to cope with stress.
Mhm.
So, you could be facing a stressor, but you could still be mentally healthy if you are coping with it well. So, very broadly, that is what mental health is.
So, we have all these discussions, especially in a post COVID world, where the idea of mental health has been highlighted a lot more.
Thankfully.
Yes. The awareness around mental health. I think first, the biggest challenge today is the stigma around it. And I
Absolutely.
think the fact that you are seeing a counselor or you are, I think the biggest challenge is first acceptance and acknowledging the fact that you have an issue.
Yeah.
Right?
Yeah.
What would you suggest would be the first step for anyone who are facing these issues? And they could be severe, they could be, maybe the beginning of something. How would you make them, or how would they accept that, yes, I have an issue?
First thing is accepting it for yourself that I have a problem. We do not have to have our act together at all times. It's okay to not be okay. It is okay to say, I cannot do this. It's
Hmm.
okay to say that I'm not fine. And it is okay to get help. Okay.
Right.
So the first step in that is acknowledging that you have a problem.
Hmm.
Okay. At least being aware of it.
Mhm.
And then reaching out and trying to get help for your issue.
Yeah. So my point is that how are you aware of it? I mean, there are
Okay.
people who probably go about doing their normal course of the day. They'll just go about doing their job, not even realizing that there is a problem.
Yeah.
Right. So the one thing which comes to my mind is maybe support system around you. But what if there is no one around you to actually point out that you have an issue?
So intuitively, you know, okay,
Hmm.
if you are not able to function normally, if
Okay.
things that were otherwise very simple,
Hmm.
like something that you were doing day in and day out, starts becoming like a task.
Okay.
You struggle with the very basic things of life, like simply getting out of bed and brushing your teeth is a task. You
Hmm.
know something is not right. You don't feel like yourself. You don't find joy in the things that you used to do all along.
Hmm.
Your social interactions with others start going down. You don't find pleasure in life. Okay, very broadly. Or you struggle with day to day things, or you live in a state of anxiety,
Hmm.
or you just basically feel out of sorts. You know when you have a sore throat, or you know when you have a fever. Even with mental illness, at least if you're aware, you can tell that you have a problem.
Very interesting point you made about social interactions. Is it true? Because I've had a few experiences with some of my friends. Some of them have actually gone out of their way to embed themselves into social circles. And there have been times when you suddenly realize that this is not the person we know of. So you said about social interaction. So it's not necessarily that a person will be completely aloof. It could be where probably the person has too much of social interactions.
That is also possible. It can often be a coping mechanism.
Hmm.
They keep themselves engaged with too many things or too many people as a way to escape from their problem. That also can be a problem.
There are buzzwords going around nowadays. A lot of buzzwords. You see them on Instagram, you see them on Facebook and stuff about self care. You know, if you just remove those buzzwords away, it all begins with you, correct?
Absolutely.
The fact that you take good care of yourself, the fact that you put your interests, your well being above anybody else. Because if I'm able to take care of myself, if I'm able to um, believe in myself or love myself, I would be able to reciprocate that around my environment.
Absolutely. Like they say, you can't pour from an empty cup.
Hmm.
You need to be full first.
Correct.
That's when you can take care of others better.
Being full first. How does that happen? Because I
Okay.
know that you, as a mental health counselor, therapist, you would be meeting patients at different cycles of their situation. So let's begin from the very beginning and talk about where you feel you've kind of identified, like, this could trigger into something.
So, first step, simplest, very easy for everyone to do. Start by taking care of your own body.
Hmm.
Eat a good diet,
Hmm.
sleep well,
Hmm.
exercise.
Mhm.
Okay.
Drink lots of water.
Drink lots of water,
Hmm.
eat lots of veggies, eat the colors of the rainbow.
Hmm.
Um, do things that make you happy,
Hmm.
like maybe like taking up a hobby,
Hmm.
whatever that might be,
Right.
doing some form of exercise
Hmm.
that helps. The other things that you can do is about along the lines of self awareness. So, journaling,
Hmm.
sitting down with your thoughts,
Right.
meditating,
Hmm.
right? Being aware of your own issues. Okay. Most often, we're not even aware of our own issues. We are a certain way, but we don't even know why we are a certain way.
Correct.
We have a certain belief system, but we don't even know why we have that belief system.
Hmm.
So sit down with that, with yourself. It's a little uncomfortable in the beginning,
Hmm.
but it is workable. And if you can't do it by yourself, there are therapists, there are coaches who can help you along the way.
Correct. One of the things which really helps me personally is journaling. I mean, just putting down out there,
Correct.
putting down and asking myself certain questions. Are mental health problems or issues preventable?
Yes.
Okay.
Yes.
All of the things which you just said, journaling, taking care of yourself.
They might not be 100% preventable,
Hmm.
but they definitely, I mean, you can definitely reduce your chances of getting a mental illness.
Hmm.
You can definitely cope with one better
Hmm.
using all of these things.
Hmm.
Okay. Whether we can prevent them 100% or not is very debatable, is very questionable.
Hmm.
But having said that, yes, certainly, if you're self-aware, if you are aware of your mental processes, your triggers, you're able to cope with them better. And if you're able to cope with them better, they're not as effective in bringing you down as it would otherwise have been.
So let's start with the causes. What causes a mental health breakdown?
Okay.
I've read a lot that it all begins at home. It begins from your childhood, and maybe some of them just, they keep building up over time, and that's how it works, right?
Right.
Your thoughts on this?
Okay. So, like with any disease,
Hmm.
there are primarily two causes of mental illness.
Hmm.
There's one which is a fundamental cause. That means most often genetics, like
Hmm.
something that makes you vulnerable to mental illness.
Hmm.
Most often genetics.
Hmm.
Like, for example, some diseases, some mental illnesses are known to be familial. They're known to run in families. They're known to be genetic.
Hmm.
They have a very strong genetic component.
Hmm.
So, some people are born with a greater tendency to develop a certain kind of mental illness. Now, that may remain dormant if there is a precipitating cause. Like, for example, if a person has a family history of, say, depression.
Hmm.
Okay. And he may have that tendency all along, but if there is no major stressor or no major trigger,
Hmm.
that tendency may remain dormant all his life and he may never have a problem. The other side, if a person is born with a tendency for, say, familial history of depression,
Hmm.
and maybe at some point in time goes through something very traumatic, say like a breakup or
Hmm.
loses his job.
Hmm.
Okay. These kind of incidents, these kind of traumas that happen in his life, his or
Mhm.
her life, can trigger, can precipitate an illness.
Okay.
Okay. And the factors that are there around it, like his support systems, his coping mechanisms, can be like the maintaining causes. So if he is in a situation where which is not conducive to healing,
Hmm.
those factors can remain as maintaining causes of his illness. So he's born with a bad genetic makeup.
Hmm.
There was a trigger, say an early childhood abuse,
Hmm.
and he continues to live in that environment.
So, when you say genetic, which is probably a family history, correct?
Correct. Genetic is the genes that you're born with.
Hmm.
That is at the time of conception, the 46 chromosomes that you get,
Hmm.
23 from your father and 23 from your mother.
Hmm.
At birth, that genetic makeup is set in stone. That doesn't change.
So, in that sense, the one of the parents has an issue of.
Correct. They can pass along those genes to you. They can
Okay.
pass along that tendency to you.
But again, as you said, that if there are really no major triggers, and
Yeah, it may not.
it
It
may
may
not.
not happen. So we will never even know if you carry the gene on. I mean, there are genetic studies where you can identify these things.
Hmm.
It's not done commonly, but it can be done. But yeah, I mean,
So-
if you don't have a disease, you'll never even know if you're carrying the gene.
Exactly. So one is genetic.
Correct.
Next, how would you put it in terms of causes of mental health apart
Yeah.
from genetics?
Okay, so usually triggers. There will be a trigger. There has to be something. I mean, mental. Okay, so genetic component is at the biological level.
Hmm.
For this biology to trigger, there has to be some external trigger for a disease to precipitate.
You use the word which is, I think, a lot of us would want to understand, the word trauma.
Hmm.
And somehow or the other, the word trauma seems to be associated a lot with early years of growing up.
Right.
Can you
Yeah.
talk
Yes.
through this?
Yes.
Because I think this is something which needs to be
Yes.
told and listened to.
Yes.
Yeah.
So, trauma is basically anything that is sufficiently disturbing or disruptive to a person.
Hmm.
Okay, it can be a physical trauma, it can be an emotional trauma, it can be a sexual trauma, it can be any one of these things. Now, there was a study done around 1995 97 in the US by the CDC. It's called the CDC Kaiser ACE study. ACE stands for Adverse Childhood Events. It was one of the most extensive studies done on this topic, where they took, I think, over 17,000 participants over a period of time and analyzed them for their means people with physical illnesses, mental illnesses, all of them. They took a very, very extensive history, and they were studied over a period of time. And what this study came down to was they identified 10 triggers, 10 events, ACEs, adverse childhood events. The higher the score, I mean, they've come out with a ACE questionnaire. Okay, it's available online. It's you can find it. I use it in the clinic. It's not
For
copyrighted.
for
It's
your
not copyrighted.
counseling?
It's available. No, for me to identify, not for counseling, but to get a history. Okay, so there are 10 identified triggers, very broadly involving things like abuse. So that can be physical abuse, sexual abuse, verbal abuse, parents not being around, neglect. It doesn't have to be something done to you. Simply being ignored is bad enough. Parents not being around, parents having mental illnesses, parents having substance abuse, parents losing a parent very early in life, a parent being incarcerated. There are 10 such triggers in that list, 10 such events in that list, which have been, they've very systematically listed them out. And the higher your score on this, the higher is the chance of developing substance abuse, mental illness, physical illness, heart disease, and even early death.
Something also comes to my mind because there is a lot of debate around it. If you look at the way some of the things which were probably never um, taken seriously, or what people would say, like, if you look at it today, fat shaming, the way
Yeah.
it was all easy.
Yeah.
Growing up, I've seen in schools, talking about someone's skin color. It's not something which has existed only or exists in the US. It happens in our country too. These are important topics growing up, which we thought were just for fun, but they are not. And
They
I
are
think
not.
as we evolve as a human civilization, I believe that awareness is coming.
Yes.
And because when you just mentioned about these things in the childhood, which you go through, some of these things also help you lose your own confidence. In schools, you are bullied. Bullying is also an example, right? All of these carry
Absolutely.
trauma, right?
Absolutely.
They all trigger.
Yeah, absolutely. So, if I may give an example, this is from the time when I was in school. So, one of the teachers pulled up a boy for not having cut his hair. Okay, he was definitely not following the discipline of the school. The ideal punishment for that would be to send the child home, cut your hair, and come back to school the next day.
Correct.
But what does this teacher go ahead and do? She ties a ponytail and makes him sit in the class the whole day with the ponytail right at the top of his head. That person is a patient, and he is still traumatized by it. He must be in his mid 40s now, but he's still traumatized by what happened. Yes, if something is not right, it needs to be corrected, but there is a way to do it. You can't inflict traumas. You can't raise your hand on children. You can't. I mean, you need to correct them. Of course, I'm not saying that excuse every mistake. Absolutely not. but there is a right way of doing it without causing a trauma.
I wouldn't really place the entire blame on the school or the parenting. I think we all
We
learn with
all,
time.
yeah, absolutely.
As you rightly said in the beginning, acceptance is very important. If you look around you, especially with this generation, the young generation, and I get to work with them a lot. I'm surrounded by them, and I can see uh, there are times when I see them calling out for help,
Correct.
and they don't get the kind of help because most of the time, someone wants to have a conversation. I think those things are missing completely. And I
Yeah.
think growing up, we were okay with it because we thought, fine. I mean, but I think now those things are changing. I mean,
Yeah.
and I bring up this point because I have conversations in our podcast on such issues. And now, when you look at it, they all tie up to the mental health situation. So, Rupa, let's talk about treatment.
Sure.
There are two aspects to it. One is, of course, the meds. That's one part of it, and the other, I think, the most important part is counseling therapy, which you're absolutely a part of.
Right.
So let's touch upon the counseling and therapy first, and of course, we'll talk about the meds in terms of um, uh, how the whole treatment plan begins. So counseling, let's talk
Okay.
about it.
So, with treatment for mental illnesses, I'd really like to use this quote from my favorite movie, Bhool Bhulaiya.
Hmm.
So, in the movie, Akshay Kumar is a psychiatrist, and he has this very, very lovely dialogue towards the latter half of the movie, where he says कि psychology is the only science without a definition.
Without a definition,
हर
yes.
दिल अलग, हर सोच अलग, हर दिमाग की चाबी अलग.
हर दिल अलग, हर सोच अलग, हर दिमाग की चाबी अलग.
So basically, the key to every mind, every thought process is different, every patient is different, and the key to every mind is different.
True.
Loosely translated, that's what it
Absolutely.
means.
Yeah, and very
So,
powerful one at that.
and
Yeah.
in short, it is like there's no one size fit all.
Hmm.
Okay, each person requires a very tailor-made therapy for him or her.
Hmm.
Okay, now with treatment, there are usually two modalities. One is medication, which
Hmm.
is very, very important. So
Correct.
certain psychiatric illnesses require medications,
Sure.
and it is required. It is not bad, it is needed.
Hmm.
There are no two ways about it.
Hmm.
Okay, I have seen some really real transformations happening once patients went on to meds. What the meds do is it's basically correcting the imbalance of the neurochemicals in the brain, which are causing various different diseases.
Hmm. Hmm.
Right? So, say if there's an imbalance in the neurochemical serotonin, that is what
Hmm.
causes anxiety or depression.
Hmm.
So, correcting that with medication stabilize the serotonin level.
Hmm.
Now, once they are stable, like once medications have stabilized their medical condition, that is when we initiate therapy, or that is the right time to initiate therapy. Because medicines bring a level of stability,
Hmm.
and a patient can see things for what they are. When someone is depressed, when someone is anxious, when someone is not in their senses, you can't see things for what they are. You can't get clarity. It's like looking at your reflection in a pond of moving water. What the medicines do is it stabilizes the water surface, so you can see your reflection more clearly.
Hmm.
That is the role of meds. Once there is stability, that's where therapies are introduced. Now, therapies are of various different kinds. There's no one superior than the other. Some work better for some people, depending, I mean, again, it has to be tailor made depending on what is suited to the patient. For some people, like maybe a more cognitive approach is better. Okay, so for them, they have therapies like CBT, cognitive behavior therapy. Okay, some people just need to talk, so for them, person-centered therapy might be a good option. Some need their emotions to be dealt with, so there is a rational emotive behavior therapy. Some people require hypnotherapy, some people require maybe EMDR or a whole bunch of other therapies, right? So again, it is tailor-made, or it depends on what a person needs. There's no one therapy which is more superior than the other. There is a place for all these therapies in treatment.
Okay. You said the meds bring in balance,
Absolutely.
and then you have this.
Correct.
But before you initiate the treatment, let's say you have a patient coming in and you realize that is there some kind of a counseling process even before the meds start, or in terms of the fact that, okay, this is how the treatment will begin, and maybe sometimes he may not be even in that shape to probably even listen to that. So,
Correct.
but I'm sure there is a process where you say, okay, does your role involve that? Do you?
Yes. So the first session for me is usually getting to know my patient. Okay, where I talk to them in detail. I do not do any therapy at that point of time. It is just history taking.
Hmm.
Okay, so we go into what the presenting problem is,
Hmm.
what are the events that led to that problem,
Hmm.
medical history.
Hmm.
Like very often there can be physical, by which I mean biological or medical conditions which can cause psychiatric like problems, right? Then there is the family history, the past medical history, all of that. It's an extensive case record.
More often than not, would you say that medical conditions could trigger?
Very often they do. So
Hmm.
sometimes we even ask for blood tests. Like for example, an underactive thyroid gland can sometimes present as depression. And it may not be clinical depression, it may just be hypothyroidism.
Hmm.
You treat the hypothyroidism and the condition reverses, right? It may not be a psychological disease per se.
Hmm.
So that needs to be looked into. That, and that we come to know only when we take a detailed history. So eating, weight loss, sleep, these kind of things give us clues as to what might be the cause of these
So
problems.
one is, of course, certain physical illnesses actually
Absolutely.
driving,
Absolutely.
and then there are like core mental health issues, which probably
Absolutely.
may not be triggered by any physical health
Correct.
condition.
Correct.
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 As you said, one size does not fit. So I mean, you'll have to really evaluate how much of. So this could be a little personal in the sense, how much of the interactive sessions during the sessions which you have with your patient, how much of that do you take? I mean, in the sense when you're out of this, I'm just trying to figure that out. What is your coping mechanism in the sense from between two patients? I mean,
Okay.
do you might be having 2 or 3 sessions
A day.
a
That's
day?
right. Yeah.
How does this?
Yeah. So it comes from years of experience
Hmm.
and it comes from having very strong boundaries.
Hmm.
Okay. So I'm here to help you. I will empathize, but I will not get caught up in your trauma drama because I'm there to help. If I get caught up, then I'm another player in your drama and
Right.
that's not going to help you.
True.
Okay. So it's learning how to be detached, that which actually helps a lot.
Hmm.
Of course, I'm human. If someone's telling me something really emotional, of course it will strike something within me. But
Hmm.
I have learned over a period of time to detach myself from it.
Hmm.
Otherwise, I will not be able to help you.
How much of a role has technology played in the overall treatment
It has
process?
helped a lot.
Hmm.
It has made healthcare, mental health care, much more accessible.
Hmm.
So basically, there's so many videos out there on YouTube and social media, TikTok and other, Instagram, where there are very, very credible mental health professionals who've made videos,
Hmm.
mental health education videos, and put them out there,
Hmm.
which people can see and understand their condition better.
Hmm.
Even if they don't get answers, at least they get ideas about what kind of a problem they might be dealing with.
Hmm.
And there are a whole bunch of apps and gadgets
Hmm.
which can help you track everything from your sleep to your diet to your heart rate to everything else.
Hmm.
Like there are apps which help you meditate. There are apps that help you manifest. There are apps that help you to journal. So of course it's played a very, very big role, and especially during the pandemic. Oh, and of course we forget, thanks to video calls, therapy has become accessible to many people,
Hmm.
even especially during the pandemic when
Hmm.
everything was in lockdown and people couldn't meet face to face. Most of my therapy sessions were online, and that made a lot of difference because in that period of time, because people were forced into small rooms together, because they were like things which were otherwise getting distracted by the humdrum of daily life did not happen, and they were like faced with all those issues. A lot of those things came up and a lot of them struggled to cope with it and they needed help. So it was accessible on video calls, and it made it a lot easier.
As a part of the treatment, we always say a healthy support system makes a difference, right?
Yeah.
Whether it is uh, your home, your friend circle. And I think there seems to be a lot of impetus on this in the corporate world, especially in that COVID phase. And as we are transitioning, some of the things still remain because, there came a phase where working couples who are no longer working, or one member of the family has always been a homemaker, and then you have the other partner
Yeah.
now working from home. And there were several domestic abuse issues which has come up.
Yeah.
And I think these issues even have been occurring even in corporate workplaces,
Absolutely.
right?
Absolutely.
So having support groups, uh, isn't that also a part of the awareness and maybe even treatment
Absolutely.
process?
Absolutely. And the best example of that is your AA, Alcoholics Anonymous. It has
exactly.
helped God knows how many people across the globe. So
Do you feel that corporates are doing enough in today's world in terms of having support groups?
there is more which can be done.
Hmm.
I'm sure there's more that. I haven't worked in the corporate setup, but
But I'm
from my
sure, I mean,
patients, yeah, I've
yes.
heard that there is a lot more which can be done.
There's a patient-doctor confidentiality out there. But you must be having patients who probably go back to work and go about doing their
Yeah.
process. So one thing is, of course, having support groups around everywhere else, apart from the meds and the counseling and the therapy. What else should I, as an individual, I should be doing apart from all of these?
Apart from medication and
therapy and the support groups you have, but
okay,
being mindful, being
mindful, being aware, journaling, writing down your thoughts, that makes a lot of difference. Physical care, like self-care, eating properly, having good sleep hygiene, these things are important. Okay, a good health, a good diet is very, very important. I mean, 90% of the serotonin, the calming hormone, the one that is implicated in anxiety, depression, 90% of it comes from our gut. So having a healthy gut does help in improving your mental wellness, right? Sleep, a lot of our processing work that happens in the brain happens when we sleep. So getting a good REM cycle sleep is very, very important.
Is there we all tend to say 8 hours of sleep is a must.
So no one gets 8 hours. Some people do. Some people even get 10 and 12. But it varies for person to person. Some people are comfortable with 5. Some even 10 is less. So it varies from person to person. But a good night's sleep is important. What else can we do? Drinking enough water, eating good, exercise. Exercise gives you a lot of good. It makes a lot of good chemicals in your body. Reduces things like cortisol, which are stress hormones. So it has a role. Definitely has a role.
I'm glad that you brought up exercise because there is a newfound enthusiasm. And in many ways, I think COVID also played a big role in that, with gyms shutting down and a lot of people at least attempting to exercise to build their immunity.
Yeah.
And I think it's really moving forward.
Yeah. Well, thanks to the online training,
Yes.
people continued their yoga, their Zumba, their exercise, and everything, even during the
Right.
pandemic.
And again, there are people who really want to exercise or want to learn, but they've never wanted to do because they were shy and conscious about it.
Correct.
Now doing it in an online mode, they
in
realize
the comfort
that
of their own homes.
it made a huge difference.
Absolutely.
Talk me through the different or the more visible form of mental health disorder. I mean, like the more talked about. I know anxiety for sure is one of them.
Most common is anxiety. I mean, I'm talking about my private practice.
Sure.
I have majority, almost 80% of my patients come with some form of anxiety. Anxiety is a very broad, very, very big. I mean, everything from generalized anxiety, panic attacks, OCD, PTSD, post-traumatic stress disorder, social anxiety, right?
Which is big, right? Social anxiety.
Very big. And of course, one part of it is the depression. Okay.
But coming to social anxiety, sorry, I'm just butting in here. But there could be people who just don't want to be in a social circle, and that's not an issue, right?
So again, it depends. Okay, there are people whom we call extroverts, introverts. Extroverts are comfortable. Introverts prefer to be by themselves, right? An introvert put in a social setting might find it very uncomfortable, right? That might just be their nature.
Yeah, that's not a disorder.
That's not
just
a disorder.
Choice.
That's a choice.
Right.
And that's fine. I mean, if you're comfortable by yourself, that's perfectly okay. Right? But you're at peace with it. An introvert will be okay if they're left alone. One cup of tea, a book, and a rainy day is heaven for an introvert. Right? But social anxiety is when you have to cope, interact with people, and it doesn't have to be social settings in terms of a social gathering. It can be something as simple as going to a bank and withdrawing money from the teller.
True.
Or it can be as something as simple as just telling the watchman that please send my parcel up. That in itself can be a source of anxiety up to a person with to a social anxiety.
So something which probably could be a disorder a few years back would be left to people around you would say, oh, it's nothing. I mean, it's just, he just has
So,
some.
unfortunately, there is a tendency for most people to brush off mental illness
Right.
as it's nothing, it's all in your head.
Right.
Brush it off, suck it up, which is not
No,
true.
that's
It's very real for the person who's going through it.
let's talk about, you spoke about these disorders. If you were to look at the age groups they are prevalent in, let's say, I'm sure
Hmm.
with regards to different age groups, they might be actually at different intensity or different.
Yeah, so again, depending on the biology and the age group, the variety, the diseases differ.
Hmm.
Okay, in younger children, we often see neurodevelopmental disorders,
Hmm.
which has something to do with the brain and development.
Hmm.
In the elderly population, it is more neurodegenerative,
Hmm.
meaning the brain going into a degeneration. It's like brain cells slowly dying down,
Hmm.
right? And everything else is usually in between, though you can see depression, anxiety, schizophrenia, etc., even in the older and younger age groups,
Hmm.
right? With young children, it's more often, I mean, the conditions that we see more commonly, of course, this is not set in stone, it varies.
Absolutely.
You can see depression even in young children, okay? So that's not, it's not set in stone. In children, most commonly the conditions that we encounter, thanks to movies which have spread awareness on these things, is learning disabilities, autism spectrum actually, ADHD, attention deficit hyperactivity disorder,
Which is, I think, probably the most prevalent,
very common.
especially right from your childhood, correct?
Correct. So you see these in younger age groups, more
Right.
commonly diagnosed in
And
younger age groups.
if not diagnosed, or if not addressed,
Yeah.
it only
It continues into adulthood. So you can have an adult with ADHD also.
Yeah.
It's not that it's childhood and done with. It carries on into so a restless individual might just be ADHD. It needs to be looked at very closely. Or someone who has difficulty focusing on one task at a time might just be
so
an
so
ADHD.
basically, depending on the age group,
Correct.
at a broad level, probably the intensity of the disorder may be different.
For the middle age group, like young adults, teenagers to young adults, that's where we most commonly see all the other psychiatric diagnoses, anxiety, depression, schizophrenia, etc. Most commonly seen in these age groups, but you can see it in younger and older. It's okay. It happens, right? The manual that we have, the guidelines that we have is what is called as the DSM, the Diagnostic and Statistical Manual for Psychiatric Mental Illnesses, right? That is the gold standard for making a diagnosis. So people very loosely say, I have depression, I'm depressed, I'm OCD, I'm this, I'm that. No, you're not. Unless you fit these criteria. So there is it's a really very well researched book which has a revision every few years, which gives very clear guidelines as to what is depression, what is anxiety, what is this, what is that, specific symptoms listed out, how many of these you need to have for how much duration to be diagnosed as such and such mental illness.
Because in our day-to-day life, we seem to use these words so lightly. I'm depressed.
Yeah.
I didn't get to do this. I'm depressed.
You may be just feeling low or upset on a day.
Absolutely.
That is not
Yeah.
clinical depression.
I'd like to keep my home and my apartment clean.
You
I
may
don't
just
have
be-
OCD. I just love to
you
live
may
in a.
you may just be meticulous, you may
Yes.
just be fastidious, but that's not OCD. OCD
Right.
is a diagnosed mental condition, okay, which is really disturbing and distressing.
Absolutely. Absolutely. Coming back to what I said, to a large extent, we are ourselves responsible for our own emotional well-being, mental health well-being.
Yeah.
And taking care of ourselves actually matter a lot.
Yeah.
The day we let that control, we give that control away to someone else,
Yeah.
all of us could become,
Yeah.
a victim of this over time.
Yeah, absolutely. And for it to reverse also, the first thing that you need to do is that locus of control needs to come back to you.
Yes.
My first question to someone who calls me to make an appointment is the person ready for therapy? Because very often we feel our husband requires therapy, our boss requires therapy, my son requires therapy, my friend requires therapy. But does that person think that they need therapy?
Right.
And unless the answer to that is yes, I do not take a patient on as a client. Because unless they are willing to work on themselves, no therapy is going to work.
What has been that one moment where you felt it has been worth it, whatever you are doing? Because at the end of the day, you touch lives, you transform lives. Is there a single moment where you felt that, yes, this has always been my calling? This is what I was always meant to do.
Yeah.
Growing up, Were there instances where you felt that this is what I really want to do,
Yeah.
or is this something which happened over time?
So when I was looking, after I completed my medicine, I
Hmm.
was looking to do a postgrad,
Hmm.
and I was looking for the next logical step in my life.
Hmm.
And that's when I first picked up Dr. Brian Weiss's book,
Mhm.
Many Lives, Many Masters.
Yeah.
And that was the turning point for me. And that is where I realized, yes, this is the work that I need to do. This is my calling. It just came, it was just like crystal clear that that's the next step.
Okay.
And the next logical steps, like where can I find the training, where can I get certified, all of it just flowed naturally.
And then, as I said, during the years of practice, where was that one moment?
So it
where-
is difficult to say find one moment
Hmm.
because the entire journey has been so fulfilling.
Hmm.
When you see someone who's not worked for 8 years start going to work again,
Hmm.
okay, because he was depressed, and he's, he is now able to, pull himself together,
Okay.
put on his clothes and go to work and not miss a single day for 2 years is
Hmm.
amazing. Okay, 2
Absolutely.
years and counting. When someone is living their life better, when you see people living their life much more fulfilled, much
Hmm.
more happier,
Hmm.
they're not pulled down by the same things which would have otherwise brought them down,
Hmm.
right?
Hmm.
When they're coping with stresses better,
Hmm.
when they're learning how to deal with difficult people in their life better,
Hmm.
when you see physical transformations, like a lot of physical ailments are also linked to mental illnesses. So when something shifts here, something shifts at a physical level also.
Right.
When you see that happening, if I may give an example, I had this girl who was struggling with weight loss for years together.
Hmm.
And in her therapy, there were a whole bunch of psychological issues that we addressed.
Hmm.
After that, she was able to drop off 20 kilos, and she has maintained it for 3 years. Now, if that isn't a miracle, I don't know what is.
It is. I think human life, the fact that we get to live this beautiful life, that itself is a miracle.
Absolutely.
And you bring so much of joy to so many people. Rupa, thank you for your this time. I think there's so much more. This is not just something which we can wrap up over a conversation. But as we say in between us, let's keep the conversation going, and every small conversation matters.
Absolutely. Absolutely.
Thank you so much for your time once again, and I would say let's keep the conversation going.
Absolutely. Because there's a lot more to be said.
There's a lot more to be said. Thank you again for listening in. Until next time, take care of your health, mental and physical. See you next time.
Thank you for listening to this episode of the Between Us podcast. This podcast was recorded at manicpod Studios in Chembur, Mumbai. Our sound engineer is Mainak Chakraborty, and your producers are Arnav Dogra and Santosh Kumar. The Between Us podcast uploads episodes weekly, and we'll see you next time.